If you would like to think like a senior technician in less than 30 days and learn the 5 teaching frameworks medical books don't teach, then you need to listen to this video. I am Dr. Kalaram. I am a GP and a medical educator. I passed all my clinical stations in my OSCE exam in my first attempt, and I have taught all my students, and most of them passed all the stations in their first attempt. The reason is the frameworks. Medical books don't teach these frameworks. Have you ever heard of the ABCDE framework, the 4-phase history taking, the traffic light approach, the ill or well snapshot, then the ABCD investigation strategy, now 1 week and 1 month approach? These are the frameworks I have developed for myself, and that helped me save time, not miss a diagnosis, be organized, and be systematic in my history taking, examination, ordering the right investigations, and the management, pass my exam in less time. If my station was 8 minutes, I was able to finish almost every case before 4 minutes, some rarely before 6 minutes. So if you would like to know those strategies and learn the frameworks and tactics the medical books are not teaching and save time and appear confidently in the clinical exam, you need to click the link under this video and make sure you listen to the strategies and frameworks. If you like them, then you can get my training program for a discounted price. I wish you all the best, and I will see you inside the video.